Yeah, good morning, everyone. I welcome you all on behalf of Apex University, Jaipur. Today we are having with us Dr. Jatin Kumar N Patel. He is the course coordinator, JP Rehabilitation Academy, and he is the HOD Bhuvneshwari Physiotherapy and Rehabilitation Clinic, Surat. Dr. Jatin Patel is very famous in this field because of his new experiments for different type of techniques. So, it may be useful in post-COVID environment. Today we will be having this particular webinar on diaphragm rehabilitation post-COVID-19. Nowadays, we are observing different type of situations in this corona environment. So I think this particular webinar will be beneficial for we all. Hope you will enjoy it. Thank you very much. I would like to invite Dr. Jatin Patel, sir, to continue his webinar.
Thank you so much, sir. Thank you so much for a wonderful invitation for Apex University. I'm going to share my knowledge about the diaphragm rehabilitation in the post-COVID patients, how we can strengthen the diaphragm muscle. Then I'm going to share my knowledge on that. This is a recent scenario, patients suffering with the breathlessness, and we have to work on the post-COVID. When person suffering with the COVID disease, that time they have some breathlessness, but after the COVID, they feel some fatigue and tired. So to recover from that fatigue and tired, we have to train our diaphragm muscle. I can say it's a core muscle for inspiration. If you want to breathe in, then we have to work on diaphragm. So I'm talking about the respiratory system. Respiratory system is a one network. In the organs, it includes the airways, lungs, blood vessels, and everything included are there. The muscles that power your lungs and also part the respiratory system. Which muscle going to help you for lung expansion and lung compression, means breathe in and breathe out. You can call as a breathe in, breathe out. And for that system, your muscle also going to work. These parts work together to move the oxygen throughout the body and clean out the waste gases like carbon dioxide. We have to push it out the side. Now the functions of respiration. Respiratory system has a many function, just not only limited to breathe in and breathe out, but it also allow you to talk and to smell. It will allow you to smell. So in COVID patient, we've seen some basic signs and symptoms. They complain about that I lost my smell and taste. So that smell also associated with the respiratory system, and it brings airs to body temperature and moisturize its humidity level for your body. It delivers the oxygen to the cells in your body system. When we're talking about the healthy cells, we have our cells, but if you have healthy cells, the word of healthy cells suggesting that they need a sufficient amount of oxygen. Once you have a sufficient amount of oxygen, you can say the cells are very healthy. And once you have healthy cells, your body must be healthy, including the organ cells or muscle cells everywhere. So we need a healthy cells. Remove the waste gases, including the carbon dioxide from your body when you're going to exhale. So when you're going to exhale, it's going to throw out the carbon dioxide, which will give you more entry for your oxygen. Our body needs oxygen to be healthy. To protect your airways from harmful substance and irritations. Like if somebody foreign body coming inside, they just try to prevent the entry of that foreign body, and they can fight with this. So these are functions of respiratory system. It's not limited to breathe in and breathe out. There are so many things which is very crucial to be healthy in state. Now the anatomy of respiratory system. How the respiratory system going to be act? In the first one is your airway. How we're going to be outside are going to inside, you can say is the airway entry. The upper airway entry made up of everything from your nose to trachea, and tube connect with your mouth to nose. This is simple basic anatomy, how it's going to work from like nose to trachea and going to expand in your lungs. The lower airways, other hand system connecting with tubes which allow your air travel to the deepest part of the lung to bring the oxygen. This includes some large tubes like bronchi. We call it a bronchi, and infection of that bronchi, you can say the bronchitis, all the way down to the smallest tube. This tube is called as a respiratory bronchis. Now, when we talk about the inspiration and expiration, inspiration means muscle, inspiration, breathe in. So for breathe in, we have to contract our diaphragm muscle. If the diaphragm muscle going to be contract, they're going to press, they're going to increase your abdominal pressure, which will allow your lungs to expand, will giving the space for your lungs to be having some expansion. The diaphragm is a dome-shaped muscle that have major drive in inspiration. When you breathe, the diaphragm contract and become flat. Normally, it's look like a dome shape. When it's contract, it's going to be flatten up and going to press your abdominal organs and try to give some space for your lungs to expand. When you breathe out, that flattened diaphragm again going for relaxation, and it will allow your lungs to just go and get squeeze and they can exhale the air. So actually, this is a process of inspiration and expiration. When we are breathing at the rest, diaphragm does not move above work when it comes to the breathing in. If you are in a resting position, so there are not much load on diaphragm. But if you are doing some exercises or if you're working position, then you have to take the support of from accessory muscle. You can say a secondary muscle that includes the intercostal, then sternocleidomastoid and scalene. We can call it a secondary muscle, or you can call it a what you can say secondary movers. Or breathing exercise के लिए diaphragm is a prime mover, external intercostal, sternocleidomastoid, scalene, pectoralis major and minor, all are secondary muscle. You can say accessory muscle, which will help you to provide more breathing. Although when the person using this secondary muscle or accessory muscle, it means his or her diaphragm muscle is not going to work properly. So we have to work on the diaphragm muscle to improve the breathing in, right? And about the expiration, normally expiration is a passive process. There is no muscle involved in the expiration. Unlike the breathing, expiration is more likely kind of a recall system. We take example of balloon. If I want to expel the balloon, I have to blow the air inside. But if I will want to remove the air, just leave it automatically, because with the recall system, everything come outside. So it's same like in the lungs. But when we require the forceful exhalation, that time we have to use our abdominal muscle, which will help you to go for forceful expiration. For inhalation, simple use of diaphragm, which will allow you to entry of air. If you want to go for forceful expiration, like so, for that reason, how to use the abdominal muscle. Otherwise, rest of process, it's passive process. Now you can see the inspiratory and expiratory muscle. Like there is, look at the attachment of the inspiratory muscle and the expiratory muscle. If I'm talking about the inspiratory, the primary muscle is your diaphragm, and other muscle which is going to support the diaphragm, it's your sternocleidomastoid, scalene, and external intercostals. This all will help you to expand the rib cage. The expansion of rib cage will allow your lungs to go for more expansion. You can take a deep breath with the use of this all muscles. For expiration, you can use the abdominal. I'm talking about the external obliques and the internal obliques, which will help you do the forceful expiration. Expiration, although passive process, but for the forceful expiration, you can use the abdominal muscles. Now, the physiology of respiratory system. We have to understand the anatomy and physiology of system. Then only we can go for assessment and examination what things are not working properly. So for the respiratory system, first one is your respiratory cycle. When breathing, inspiration, the respiratory muscle contracts and lead to the go for downward movement and going to increase the space for your rib cage. During this exercise, accessory muscle also going to be come in role if your primary muscle does not have a proper contractions. When you breathe out, the relaxation of inspiratory muscle as a process of elastic relaxation that will lead to throughout the air. It's a passive process. Now, how does this COVID-19 going to be affect your body? For that COVID-19, this particularly novel coronavirus spread via the droplets and expelling the infected person throughout the coughing, sneezing, and exhale air. Infection can be spread regardless where or not individual symptomatic. So many times we've seen that the person is clearly asymptomatic, but they also have some mild to moderate symptoms like cough, fever, and shortness of breath. When we're talking about the shortness of breath, we have to rule out the rate of respiration according to the 1 minute. How much respiratory rate was that? It's about to 20 to 20 is good. If it's less than that, there is something. So we have to find out the respiratory rate, and we have to check for the saturation of oxygen, like SpO2. It must be above 95. If it's below 95, it means the person needs a higher amount of oxygen. However, in more severe cases, the infection can lead to the pneumonia. Initially, you have symptoms like cough, fever, and shortness of breath. But when the disease is going to be progressed, they can lead to the pneumonia, which is inflammatory conditions. And the teeny air sacs going to be inside your lung. I'm talking about the alveoli that give the inflammation. Pneumonia can lead to the acute respiratory distress when a person needs some oxygen support. Not only simple oxygen support, but sometimes they need to have a BiPAP, like I can say secondary ventilator. And at the end, for artificial respiration, we can put the patient on the ventilator. So for that, once person get recovered from the COVID-19, but still they have some issues with the breathing, they can complain within a few minutes. If I want to walk for at least 100 meters or 150 meters, immediately I can feel the breathness. So that particularly because of the fatigability of respiratory muscle and fatigue of your body. So how to recover from that fatigability? We can call it a pulmonary rehabilitation. For the process of that pulmonary rehabilitation, we have to suggest for initial time, we'll start with the rest. Because once your muscle will be in the relaxation, complete relaxation, then you can ask them for maximum contraction. Until and unless if you don't have a contraction, you cannot get the proper strength. So if you want to be healthy, if you want to be strengthened up, then you have to take rest after the COVID, then we can start the exercises. So my suggestions for the COVID patient, don't go for directly for physical activities. Start with some rest and start with the what I can say, breathing exercises step by step. Then you can go with the peripheral activities like upper limb exercise and lower limb exercise. So those who love to go for gymming activity, they have to take a rest of 1 week. Then later on, by the progression from rest to the registered breathing exercise, they can go for the gymming activity. Like for rest, many people who are suspected having had a virus report the fatigue or tired. One of the classical signs and symptoms for post-COVID, that they complain about the fatigue and tiredness. Your body is using more energy stored to fight the virus, and infected cells are going to be in your lungs. Even with the mild symptoms, not only in the major symptoms, but even with the mild symptom, you could have some days when you feel fine, other than you can feel more tired and sore. When you are fatigued, stay at home and rest at home as much as possible. When you feel relaxed, you can go out and you can work over there. You can start your work, but until and unless, just try to focus on your fatigue. For fatigue, best option, just give the relaxation. Now, second thing, if you completed your rest period, then you can jump on the breathing exercise. For breathing exercise, breathing exercise should be safe, and for those individuals who are not experiencing any breathlessness. It means if you have a breathlessness, you're not going to start directly the breathing exercise. You have to keep yourself relaxed. Try to maintain the SpO2 around 95. Try to maintain the normal rate of respiration. Then you can start the breathing exercise. If you're directly going to have a breathing exercise, might be you're facing the breathlessness. So what is breathlessness? Breathlessness is defined as an uncomfortable, rapid, or difficulty in the breathing. I can say uncomfortable breathing or difficulty in breathing, you can define as a breathlessness. So for the fight with breathlessness, we can give the breathing exercise. In that breathing exercise, we can start with the diaphragmatic breathing exercise. Step by step, you can go with the pursed lip breathing, and you can start with the other techniques like glossopharyngeal breathing. These all are included in the physiotherapy and cardiorespiratory. Mainly, they are going to focus on your diaphragm muscle, how to train diaphragm. If you're asking me the rehabilitation for diaphragm, if you have complete paralyzed or what I can say underactive diaphragm, then you have to work on the diaphragm. You can start the work on diaphragm with the sniffing exercise, which will help your diaphragm to create small contractions. That small contraction going to activate your diaphragm. I'm talking about this kind of sniffing exercise. In initial time, you can start this. Once you have a good control with the sniffing exercise on the diaphragm, then you can start your diaphragmatic exercise. It must be going to follow by the what I can say semi-fabulous position, means sleeping position. Then you can start in the sitting position with some progression. initially in the semi-fowler's position, just give a relaxation to your abdominal muscle, which will allow you diaphragm to contract and make it flatten up, which will create more space for your lung to expand. After that, you can ask your patient to keep your hand over there to provide some more resistance. In later stage, you can provide resistance via use of sandbags or via use of any kind of resistance. Then once your patient is comfortable with the sandbags and other things, then you can make them in a sitting position. And the sitting position, you can start the few other exercises like a pursed lip breathing, and you can go for the glossopharyngeal breathing. This exercise will teach your patient how to control the breath, how can hold the breath. Normally, when we talking about deep breathing, when we ask someone take a deep breath, so they're going to take a deep breath with the use of this accessory muscle, like they want to expand the chest. But when we talk about the deep breath, actually in the deep breath, your abdominal muscle abdominal area going to be increased, because diaphragm muscle going to be contract and they're going to push your abdominal region and they're going to expand the abdominal diameters. But what we feel for deep breathing, like take a deep breath, we are going to perform this deep breath with the use of this accessory muscle, or you can say secondary muscle. So we have to correct this use of secondary muscle or accessory muscle. During your examination and assessment, you come to know there is a less expansion of abdominal diameters, so we have to work on diaphragm. Like from diaphragm rehabilitation, we will start with the stiffening exercise to activate the diaphragm in initial stage. One of the best exercise if you want to work on diaphragm, not only for what I can say those who are suffering with the COVID, but if you want to keep yourself healthy, you must need to follow this exercise in early morning. So yoga is the best exercise to deal with the diaphragm. I'm talking about the inspiration. During your assessment and examination, if you find it's your underactive diaphragm muscle, so you must need to go for release of diaphragm muscle. Gradually, we will start the diaphragm breathing from lying position to sitting position with the different posture. And at the end, you can start with the strengthening of diaphragm muscle. That can be start once you assess everything is normal, then you can go ahead. Right. For diaphragm release, as my expertise in the instrument assisted soft tissue mobilization, allowed to release the diaphragm. Actually, we have to locate the floating ribs. At the end of that floating ribs, just underneath the rib, there is some dome-shaped muscle. So we can put our tool and try to touch the diaphragm and push the tool a little bit downward. Try to roll the tool on the diaphragm muscle and try to release it. So not every time we have to just activate, but sometimes your diaphragm must be going to be tightened up or underactive. So about the process of that release, or I can say activation, you can use this kind of instrument assisted soft tissue mobilization techniques for diaphragm rehabilitation. It's a wonderful technique to use. Normally in the breathing exercise, we just going to teach them how to take a breath, how to hold the breath. But in this, we just want to touch the diaphragm and want to release. When you are going to touch the diaphragm, your muscle, diaphragm is one muscle, and your muscle having a muscle spindle. The activation of that muscle spindle will help you to create more contractions. And that contraction will help you to allow what I can say dome-shaped diaphragm to create the straightening, which means it's going to increase the pressure in abdominal area. So they will give more space for your lungs to be expand. So you can take a deep breath and you can hold your breath very easily. If you don't have a proper strength in diaphragm, you will feel some breathlessness or you can feel some shortness of breath. So let me show you one video for diaphragm rehabilitation. Ribs, just underneath the floating ribs, I can palpate the diaphragm. हाथ से अगर रिलीज करना है तो ऐसे रिलीज करते हैं डायफ्राम। ये नीड समय मुझे।
अरे नहीं।
So this way we can go for release of diaphragm. Just try to palpate the diaphragm muscle just underneath the rib and put your tool over there and go for release. Before ISTM, we have to apply some emollients. Right now I'm going to apply some emollients over there so we can prevent the friction between ISM tool and the skin, because it's about the working on the soft tissue. So it should be a soft work. So then only patient will allow me to go as deep, because I want to touch the diaphragm, I want to release the diaphragm, I have to go little bit deeper structures. So if you want to touch the deep structures, you have to be relaxed in state. So this is about the manually release diaphragm, how we can manually release the diaphragm, because same structures are there. So the same structures going to be create some issues, like when I'm going to roll my thumb over there, patient must be feel some uncomfortable. So to remove that uncomfortable sense, we just trying to use a against a bevel edge tool, which is very light in weight. So with the use of this technique, my hand must be in the wrist extended position, elbow extended, and try to go inside. It should be done by the 3 segment. In a first breath, we just try to push. When person going to be exhale, we're going to enter our tool inside. In second breath, just try to push the tool downward direction towards abdominal. In a third exhalation, we're just trying to remove the tool with the curve shape. You can say this is a kind of scooping strokes to release the diaphragm. At the end, like what I say, pre and post technique for the diaphragm release. You can see at the end that the person can increase the abdominal diameters. Means person can use the diaphragm muscle. So diaphragm muscle contraction will going to increase the abdominal diameters. So this way we can work on the diaphragm muscle. So this is everything about the diaphragm rehabilitation. If you have any questions, then you can ask me in this session, or later on if you want to ask me. So you can find out in Instagram and Facebook, or you can contact to your HOD, Dr. Piyush, and you can ask me anything more about the diaphragm rehabilitation. But in initial phase, I'm suggesting don't go for some vigorous exercises. Start with some rest, then step by step give the activation for your diaphragm. From that activation of diaphragm, start with some basic exercises of diaphragm. I'm talking about the diaphragmatic breathing exercise. Then start with some resisted diaphragmatic breathing exercise. Try to change some postures, because posture also going to matters a lot when we're talking about the breathing exercise. Then later on, we can start with the other exercises. Right. So thank you so much for a wonderful session about the diaphragm rehabilitation. I'm very thankful to Apex University and the Dr. Piyush to invite me for this online session. It's always my pleasure to share my knowledge about the diaphragm rehabilitation, because I love to work on the soft tissue, especially with the ISTM. I did so many research, and the under the what I can say real-time ultrasound. Also, we see the effect of ISTM. So we come to know with the use of ISTM tool, again we can work on the diaphragm. Although this is a division of cardiorespiratory, I'm not from cardiorespiratory division, but still it's a human body which is going to be interconnected. If I'm talking about the cardiorespiratory division, still they need some muscle work. They need some muscle contraction. So we have to correlate from musculoskeletal disorders and the respiratory disorder. We have to club it. So we can create the protocol. I can say treatment protocol. We have to target each and every system, not only just lungs. We have to focus on the lungs, but we have to work on the muscle. We have to work on the postures. We have to work on the what I can say body alignments, which will help you to overcome from breathlessness. So thank you so much for this session.